This is CNN.
Thank you, Dead Right Team, and welcome to your pretrial update. First, I would love to give you a brief history of assisted suicide. When mentioning the word euthanasia, the first thing that comes to mind is the epic assisted suicide battle of the 1990s, starring Jack, Dr. Death Kevorkian. But whether or not human beings or doctors should have the right to help others commit suicide is one topic that has been in public controversy since before the birth of Christ. Starting with the Hippocratic Oath, I will not give a lethal drug to anyone if I am asked, nor will I advise such a plan. It is an oath that in today's society many doctors will not take. The century-old debate over whether a person has the right to die, usually in cases of a painful, terminally ill patient, is curtain-grabbing headlines with the arrest of a four-member group called the Final Exit Network. And these four members helped an Atlanta man commit suicide last June, which, if proven, is a violation of the Georgia state law. The idea that it should be illegal to help someone commit suicide comes from the biblical commandment, "Thou shalt not kill." But despite this, several Judeo-Christian societies have condoned assisted suicide in recent years. Australia legalized it in 1995, only to withdraw it a few years later. Netherlands and Switzerland have also legally recognized the practice as well, paving the way for a British man named Craig Ewart to travel to Zurich in December 2008 with the intent of taking his own life. Ewart's journey and his death were broadcast on British television. Although British laws make it illegal for someone to help someone commit suicide, authorities have opted not to prosecute Ewart's family or others who have made the journey to Zurich to help commit suicide. The debate continued in 2005 with the case of Terri Schiavo, who was a Florida woman in a vegetative state who had her feeding tube removed, which essentially took her own life. And after the prolonged political and legal battles, Schiavo's husband, Michael, stressed Terri would not have wanted to be kept alive in that state, while her parents had argued that her mental compatibility could have been improved with therapy. The Schiavo case, and others following it, fueled the debate over whether humans should have the right to die with dignity. After ruling in 1997 that Americans do not have the constitutional right to doctor-assisted suicide, the U.S. Supreme Court said in 2006 that such cases should be up to the state. Oregon has a Death with Dignity Act in his book since 1997. And in 2007, some 46 people committed suicide in Oregon under the law. Last November, Washington passed similar provisions allowing patients with six or fewer months to live to take doctor-prescribed medicine to help them commit suicide. The most memorable case of assisted suicide was one of Dr. Kevorkian, who developed an assisted suicide machine to administer lethal doses of medication. And he spent over 7 years in prison for his efforts. He claimed to help 150 people die of suicide, but was locked up over one particular case of a 52-year-old man with Lou Gehrig's disease. Kevorkian, who helped this man commit suicide, videotaped the death and allowed it to be broadcast on 60 Minutes in a brazen violation of Michigan law, which is a very controversial issue. The topic of assisted suicide is one that shows no sign of slowing down, with many demanding the right to die with dignity. Others are declaring it our society's way of playing God. But with the history in place and these past cases in the background, this leads us to the most recent case of Baxter v. Montana. Baxter v. Montana involves one Robert Baxter, a 75-year-old retired truck driver with leukemia from Billings, Montana. On October 17, 2007, Mr. Baxter asked the court to affirm his legal right to die with dignity, to accelerate his death so he can die in a peaceful manner. He was accompanied in his case by his 4 Montana doctors and Compassionate Choices, who just wanted to know if they had the right to help this man die with dignity, and they would not be legally prosecuted for it. The people of Montana ratified a new state constitution in 1972 that included the explicit right to privacy. The Montana Constitution states that the right to privacy is essentially the well-being of a free society and shall not infringe without the showing and compelling state interest. Since the ratification, the Montana Supreme Court has consistently and clearly held the dignity and equal prosecution clauses and said that they are even better than most federal and U.S. Constitution. Finally, Montana has demonstrated the commitment to providing all terminally ill patients with good end-of-life care, ensuring that no terminally ill Montanan need choose the dying in aid because of the lack of pain and system management. But on December 5th, 2008, Mr. Baxter died of his illness just hours before Court Judge Dorothy McCartney ruled that the Montana constitutional right of individual privacy and human dignity taken together encompasses the right of a competent terminally ill patient to die with dignity. The state, however, filed an appeal. And in this appeal, the state asked for a stay of the lower court ruling pending the appeal. Judge McCartney denied this request in January 2009, meaning that her ruling was fully effective and remains so unless the Montana Supreme Court ruled differently. This leads us to where we are today. The Montana Supreme Court, waiting on a ruling on the Baxter v. Montana case. And hopefully we can put closure to this case and find some kind of solution to the answer. Thank you very much. And back to you, Dead Right Team.